Assalamualaikum. My name is Dr. Adnan. Adnan Sudar. I am here to represent my history taking skills, and I will tell whole of the class how to ask questions during history taking. First, we do opening consultation from the patient when we take our history, and before before doing that, we wash hand, then introduce ourselves. Like I introduce myself. Then we will go for general information of the patient, like name, age, sex, occupation, address, etc. Then, because patient is here to present his chief complaint, he came with chest pain. Then we will use opening question to explore the patient as a presenting complaint. Then how we will ask question there? We will ask, what brought you to in to see me today? Why are you, and you can ask, tell me about the issue you have been experiencing. Then patient will say, doctor, I have chest pain. Then you give patient some time to elaborate what type of chest pain is, or you can also ask more questions. Okay, if you have chest pain, can you tell me more about them? Can you explain what that pain was like? So you will go for you will explain in history of presenting illness, like which site were onset, like that. So how you will ask about site? You will ask, where is the pain? Can you point it where pain is? Then he can explain, I have chest pain and that is radiating to my jaw and going to left shoulder, like that. Then you will ask about onset. Did the pain come suddenly or gradually? What did pain first start? Did the pain come at rest or while you were experiencing an exercise? Then go for character of the pain. In character, you will ask, how would you describe the pain? Is the pain constant or does it come and go? Then you can ask, is it radiating anywhere else or not? Then associated symptoms. You will ask, are there any symptoms that seem to be associated with pain? Like you have any other symptom in your body, like fever, any cough. And you can ask about the time course of the pain. How has the pain changed over time? Why we are asking this question? Because this is useful to determine chest pain have progressively worse over the time. An example might be a patient describing the chest pain that was initially present during the exertion, which is now present and rest, as is seen as unstable angina. And we can ask about exacerbating or relieving factors. How we will ask the question, does anything make worse the pain? Does anything make the pain better? Like MVC, sometimes coughing makes the pain worse. Also, really, if we ask about the betterment and patient is sleeping, he is okay, and he start to walk, then there is a pain. This is a chest pain. And we can ask about severity. How severe is the pain? Because in this case, we ask severity from taking scales. If we ask the patient from scale 0 to 10, what marks or what number you will give that pain, then he can tell you about that pain. Then you go for past medical history. How you will ask question, do you have any medical conditions? Are you currently seeing a doctor or specialist regularly? Then past surgical history. If he have gone through any surgery, then you can ask, have you ever previously undergone any operation or procedure? If he say yes, I have gone through, then you can ask about what type of procedure was, when was the operation or procedure, and why was it performed. Then go for any allergy or drug history if he is taken. Then you go for family history. In family history, you can ask question: do any of your family or sibling have any heart problem? Because they come with chest pain, and most of child, and we see in respect or family history at present. So we can ask: have any of parents and sibling previously has been diagnosed with any blood clot? Then ask about the social history, that does he smoke or not, does he drink or not, because alcohol is risk factor for angina and MI. So we can ask social history about: do you have any pets, do you what do you do for living. This is some type of personal questions. Then, after taking general history, we go for systemic history. In systemic history, you can ask 1 to 2 questions from each of the system to confirm whether it is just related to the heart or any other thing. So first we will go for cardiovascular history. First, risk factor for ischemic heart disease. On the basis of risk factor, we will ask questions. Have you suffered from hypertension, diabetes, high cholesterol? Does it hurt more or deep breathing or cough? Because deep breathing or cough like pleuritic chest pain, maybe it may be pneumonia, but we are considering mistakenly as a heart disease. Even you can ask, do you have fever or productive cough? It is also seen in pneumonia. Do you have any history of heartburn, hiatus, or reflux disease? Because gastroesophageal reflux disease also causes chest pain. In respiratory history, we can ask whether he has shortness of breath, because shortness of breath comes with angina and maybe any other things. Like how we can ask, how to ask question. We will ask, how long have you been short of breath? Do you normally get short of breath? Do you have chest pain which is worse on breathing deeply because of we see in lower respiratory tract infection? Do you have sharp chest pain that is worse when you breathe in? Do you have tender swollen legs? Have you coughed any blood? Because cough in blood also seen in pulmonary embolus. And we go for gastrointestinal history. First, we will ask from dysphagia, solving difficulty. When we are taking history of dysphagia, ask the patient, what have you focused most difficult to swallow? Solids, liquids, or both? When did you first notice this dysphagia? Did it come on suddenly, on day, or has it been a gradual process? Because sometimes we see dysphagia first is for solid, then it go for gradual for liquid. Because we say it is a sign of cancer. Yeah, why are you laughing? And also, sir, also we see hemat message, blood and mucus. We can ask, where you entering or vomiting before the blood? We see Merriweather tumor, Merriweather syndrome. Do you have pain in your upper abdomen? Do you have any past history of indigestion or ulcer? As we see ulcer bleeds, so there may be pain and also there will be vomiting blood. and we can ask about diarrhea if we do you have suffer from fever, abdominal pain, or vomiting? Have you been eaten uncooked food? Maybe because of diarrhea, but this is a general. How you will take jaundice history? You can ask when taking the history of jaundice. Ask the patient, when did you first notice the yellow thing to your skin and eyes? Have you ever had this before? Have you any family history of jaundice? Because jaundice come with family history like in Gilbert syndrome. Also, you can ask the patient about rectal bleeding, because when taking a history of rectal bleeding, we can ask the patient when did was first noticed bleeding, what is the color, because why we are asking color, because on the basis of color we can diagnose what is the disease. Like bright red color is seen in hemorrhoid, and also it is can ask whether it is painful to pass the stool. So because bleeding with painful passing of stool can be seen in anal fissure. Then we can go for eye examination of the patient, and how we will ask the history for eye examination. Then we can ask, do you feel pain in your eyes? Seen in redness, keratitis. How severe is the pain? We can ask the severity. How you notice any redness in your eyes? Do you feel any change of vision like decreasing vision? Do you feel that your eyes are dry and you do frequent rubbing? Do you need any helping aid to read book or paper like glasses or any lens? Go for ENT examinations. You can ask, do you feel pain in ear? Do you feel ringing in your ear like tinnitus due to any trauma? When someone calls you, can you hear properly? Then you can go for ENT examination, ENT history. You will ask question like that. Have you ever had nosebleed? You are asking for epistaxis. Have you noticed any abnormality in your smelling ability? Have you ever had gum bleeding? Have you ever had mouth ulcer? Have you noticed any foul smelling discharge from nose? Have you feel any difficulty in swallowing? Do you notice any voice change like hoarseness of voice? Then you can go for genitourinary history. You can ask about hematuria. What color is your urine? Because sometimes urine color changes due to some medicine like rifampicin, and also can be changed in case of beetroot, as we say in chucandar. These causes discolored urine. Also go for neurological history, because some type of pains may be due to any neurological problem, or maybe any scared illness. We feel, doctor, I am dying, I have a pain. So you can ask them, what were you doing at the time? Because when you watch TV or flashing light, when someone is watching TV, he can, because of flash and light, and he fall down, seen an epileptic. Where you coughing, cough, syncope, and where you passing urine, micturition, syncope, we can see. We can, where you stand up, like someone is standing and fall down because of postural hypertension. Where you are experiencing yourself, like climbing stair, any during climbing stairs fall down. What is caused because of cardiac valve abnormality? And we can ask about headache. How we will ask about headache history? We can ask, when did you first feel this headache? Do you have a stiff neck, fever, dislike of light? Do you have a rash or any joint pain? Have you been feeling unwell recently? Why we are asking this? To check whether it may be case of meningitis. Then you go for musculoskeletal history. Here you will ask, have you had any recent trauma? Have you had any past surgeries? Do you have any problem with mobility? Do you have noticed change in a gait or way of walking? Have you been diagnosed with any health condition related to your musculoskeletal system?
And picture here. Okay, after that we take skin, obstetric history.
After taking every history, then you can go for medical examination, and here you will go for general examination, local examination, and cystic examination. In general examination, you can check vitals like patient pulse rate, BP, temperature, respiratory rate, SpO2, and weight. And also in local examination, you can go for inspection, palpation, percussion, and auscultation. After taking examination, you can diagnose you can diagnose the patient. If you have any definitive diagnosis, then go for further investigation and treatment. That's it.
Okay, everyone send your PowerPoints in the 2018 group.